Do you know the difference between an MD and a DO physician? Did you know that there are two separate types of schools in which U.S. physicians can be trained? I will answer these questions and more in this video, so stay tuned. Hey everyone, welcome back to the Get Admitted MD channel, where I will teach you how to succeed as a pre-med and get accepted to the medical school of your dreams. My name is David Janicek, founder of Get Admitted MD. If you have already subscribed to this channel, thank you. If you haven't subscribed yet, be sure to hit that like button and subscribe to this channel while you're at it for more information about the journey to become a physician and what it is like once you are a physician. Today I want to tackle the debate that has been around for a long time in the pre-med world, the question of MD versus DO. Besides the two letters behind your name at the end of a long 4 years, what does it really mean to be an MD or a DO? I will approach the subject via a series of questions that I often get asked about the topic. So here we go. First, what do the letters mean? I wanted to start this discussion simply by defining the degrees. MD stands for Doctor of Medicine, while DO stands for Doctor of Osteopathic Medicine. Long story short, both of these degrees are doctorate level degrees that will allow you to practice medicine in the US. The further differences between them will be outlined as we move forward in this video. So the next question is, what is osteopathic medicine? There are two main points that set osteopathic medicine apart from the allopathic medical philosophy. First is the overall holistic approach to health and disease. For example, the osteopathic philosophy focuses on not just the organs and disease processes that may be occurring for that patient. It also focuses on the patient in general and how to improve their overall health at any given time. Secondly, the study of osteopathic manual manipulation, or OMM, is something that MDs do not get exposed to during their medical training, while DOs do. This additional training allows DOs to have another tool in their toolbox to help treat patients without having to prescribe medicines or expose the patient to surgery. So how do the application processes differ? In general, the application process for both MD schools and DO schools are quite similar. There is a centralized application service in which you can send your application to for the various schools in which you are applying. After this point, the schools will review your application and will send you secondary essays. These secondary essays are school-specific and consist of questions that the school deems important to know how you would answer them. Once you have submitted the secondary essays, then the school may extend an interview invitation. After you interview at either an MD or DO school, you may be offered an acceptance, placed on a wait list, or rejected from that school. Here's where there are some differences between the two types of schools. Although this is changing slightly over the years, DO schools have historically been viewed as easier to get an acceptance given your academic credentials. I say that this is changing because DO schools are getting more and more competitive, and with this, it will become harder to get accepted. One possible reason that DO schools are looked at as easier to get accepted to is that they generally look at the whole application before screening the application out. Some, but not all, MD schools have a reputation of screening out great future physicians based on a lower than average MCAT score or perhaps their GPA. There are also some minor application differences, including a slightly longer application timeline. The DO application often extends into the early spring, while the MD timeline is wrapping up at that point. A very popular question I always get is, what specialties are DO friendly? Historically, a few specialties have been considered to be easier to match into for DOs. These typically include anesthesia, internal medicine, and family medicine, to name a few. The exact reason for this is unknown, but if you are interested in one of these specialties, then it doesn't matter as much if you are a DO or an MD. On the contrary, what specialties are not DO friendly? While technically a DO can go into any specialty they choose, there are a few specialties that have been historically harder for DOs. These include neurosurgery, orthopedic surgery, and dermatology. I am not saying that you cannot be a DO and match into one of these specialties. It just may be a bit harder to accomplish. At the end of the day, most students will ask me, should I apply to both types of school? The short answer is, it depends. The long answer is that it depends on several factors, including your interest level in the osteopathic philosophy, if you are a first-time applicant or reapplicant, your academic credentials, among others. If you are truly interested in the osteopathic philosophy of practicing medicine, then that's great, and you should definitely apply to osteopathic schools. You may be asking, why does it matter if I'm a first-time applicant or a reapplicant? Well, the answer has to do with the opportunity costs, or the cost of not doing something. What I mean by this is, if you are a first-time applicant only applying to MD schools, the opportunity cost of not gaining acceptance that first year is less than those associated with a reapplicant reluctant to apply to DO schools based on any perceived stigma towards being a DO. For example, if you are a first-time applicant, the lifetime opportunity costs of not getting accepted your first year is essentially equal to 1 year of a physician's salary, anywhere between $200,000 and $600,000 depending on your specialty. If this is your second time applying, however, and you don't get accepted anywhere, then your opportunity costs are 2 years of a physician's salary, which is now adding up to a significant amount of money. While on the other hand, if you just apply to DO schools your second time applying alongside MD schools and you gain acceptance to either one of these schools, then you won't lose out on a second year of a physician's salary. Another popular question I always get is research as important to osteopathic medical schools? While all medical schools typically have a basic desire to expand the knowledge base of the medical field in general, osteopathic schools typically don't do as much research as allopathic schools. While I am not saying that it's not possible for DOs to get involved in research, it just historically has been not as common. After the residency process, does it really matter which degree you have? I think this may be the most important and underrated question of this entire video. While the residency application process can focus a bit more on the type of degree you earn, once you get past this time period and are a practicing physician, very few of your patients are going to know the difference. They're going to care more about whether or not you are a nice, caring, compassionate, and competent physician. So all in all, this debate has been around for some time and will likely be around for much longer. At the end of the day, both MDs and DOs are fully functioning and credentialed doctors who will provide great patient care in the specialty of their choice. Well, that's all I have for you today. I hope you learned something about the MD versus DO debate. Please let me know below what questions remain. See you next time.